the All Russia organization. Please, you can send your congratulations. It's not easy to get this kind of name only once you cover half of territory, and we have 57 regional association or for our interregional public organization of cancer patients. We are we have more than 150,000 people in our association. And who is Firuza Abdullaeva, who is our participant, is representative of European Coalition of Breast Cancer in Tajikistan. Firuza, hello to you. Ulas Vasavi, it's director of Eurasian Council on Cancer Research of GACAL, the charity trust from India. Milita Vujnovic failed to join us today, but her assistant is online, and Milita from WHO, she will actually get all our messages and translated to the World Health Organization. She is representing this UN office in Moscow. Ulabani Rekha Chandra is from India. She is the Cancer Patients Association head. Delisha Klein, she is board member of Eurasian Cancer Patient Coalition from Ireland. Hilola Zakharova, and she is from Tajikistan, Treatment for Everybody Association. Tinara Kasimova, she is coordinator of Ergene Foundation from Kyrgyzstan. Kosit Smaya, president of Association of Lymphoma Patients from Serbia. Larisa Lapata, the president of the Kyiv City Public Organization Amazonki from Ukraine. Nasib Nazirova, she is lawyer from Tajikistan. Inga Pasichenik, president of the Center of Health Strategies and Policies from Moldova. Petsa Terji, the head of the Northern Estonian Center of Tartus University. Filipovich Sava, the president of Association of Melanoma Patients from UPOM, Serbia. Dilbar Tabarova, she is a patient from Tajikistan. Dr. Ilya Timofeev, head of the Cancer Institute of Moscow. Ilya Valeryevich, Fatima Figinar, project developer and project manager of Dance with Cancer Association from Turkey. Serdar Erdogan, director of G-MEN Europe and Middle East patient programs. And I am very happy to welcome you all and all organizations which represent different nosologies. And we always say that breast cancer and patients and those women with reproductive organ patients are most active in our association. But still we are talking about the follow-up care of our patients under the pandemic of COVID-19. We have a representative from Murmansk, Svetlana Alexeyeva Perima, Nadezhda Alexeyeva from St. Petersburg, Anna Trubkina. She's from Murmansk. Ah, okay. I'm very hopeful that the colleagues will still be joining, and I'm asking the IT engineer to get in touch with these people. And on the agenda, we have three uh, goals. The availability of modern diagnostic tools of malignant tumors under the pandemic setting, and the availability and necessity of vaccination for cancer patients, because we would like to share experience how it's going on in your countries, and are there any data collected, and do you have any guidance from your healthcare systems? And our third issue to discuss is the importance of post-COVID rehabilitation for cancer patients and the use of online rehabilitation for cancer patients and kind of online rehabilitation program. I believe that we can dwell on these issues in detail, and I would like to give the floor to each of those who wants to tell us and at least briefly describe us. So what can be replicated in our countries? What are the advances in this issue? And let's start with the availability, accessibility of modern diagnostic tools in your countries. And we monitor the situation here in Russia in March and June. We did among the a survey among cancer patients, and we stated that our cancer service is managing quite well. Out of 1,500 people surveyed, most of patients said that they succeed in getting the necessary care, and sometimes they go to another healthcare provider to get needed medicine, and but still they would get it, and diagnostic sometimes would come later, or the scope of it was lesser. But palliative patients faced more challenges. A number of them followed up at home, and it was very hard to continue the follow-up care, but still 82% of Russian patients said that our cancer services works fine, although we actually expected a disastrous situation in this, and we anticipated reports that drugs are unavailable, no treatment they're getting, but it didn't happen, and both patients and physicians were sick sometimes, and even whole units were closed because of the disease, and all personnel on sick leaves. But then still we saw that measures were quite adequate and quite rigid, quite stringent on in isolation, and people would wear this protective equipment, and hospitals were closed for outside visitors, and only some food or some parcels can be handed over to hospitalized patients, and these staff were even treated by ultra UV irradiation, say Pampers, but still we it wasn't homogeneous across the entire country. There were some regions where we heard reports that even traditions didn't allow this, like in the Caucasus, for instance, a person dies, and you see the tradition is that entire village, neighborhood comes to bury, to the funeral, and then the entire village becomes, you see, infected, and the people were then dispatched to hospitals by helicopters. But I believe in March this year, in a year time, we had a clear understanding what is permissible, what is not. And finally, we learned how to wash hands properly and how to socialize. What other positive developments we can see? We had a new monitoring system in place. It means that if a person gets infected and a person tested positively for COVID-19, a register, the person is entered in the registered, which is all Russia register, and it has all data there and all your contacts within the last week. And if a person says, I was in an apartment number 40 and I have 10 people living with me, then all 10 people would be screened and isolated, and then they would stay inside the apartment without going anywhere. And this monitoring system is still in place. And if you move anywhere and in your building, in your classroom, and you had a COVID patient, then it will be a violation, and there can be even like persecution and fine imposed on the person. I believed that the system is not bad. And besides, a person who is sick has to keep an application in the phone, and every 3 hours a person needs to show that he or she is inside the flat. In the same, if a person doesn't do it, then there is an alarm, and then the question comes, where are you now? Please come back to where you're supposed to be. And on the one hand, it prevented movement of people, but on the other hand, if a person is sick and you take medicine which is very drastic, and instead of sleeping you and you need to respond to those calls and report every 3 hours, and the people were very much irritated by this. And on the other hand, the person is strictly controlled in the isolation, but not clear how a person can get food stuff. Who will bring these products to the door? In Moscow, it's easy. We have a courier service everywhere, and if it is a small location where there are no those door-to-door delivery, so the measure was good, but it didn't work well in all places, and wasn't applicable to all locations. And in a time, they have changed their approaches. But for instance, it was forbidden, like it is now, to be in a park and to sit on a bench. However, outside the park, it's just you can be and do whatever you want. Therefore, if you cannot uh, walk in the park, why are you allowed to walk in the streets? The only requirement was, or the rule was, that you are allowed to go to a shop to buy needed food. Therefore, not all things were considered. Well, we spoke with Jacqueline today, and I told her that I like the Chinese rule, which prohibits people traveling away from their neighborhood, from their city, even if you are on assignment, or uh, you're not allowed at all. And here is summer in Russia, people want to go um, vacationing, and therefore what is required for holidaymakers is that they need to have a certificate that they're inoculated, and or that they have antibodies because as a post-COVID patient. But still, we cannot state unequivocally that people stick to these rules. It's impossible then. And if they go to some hotel or sanatorium or rest recuperation center, then you need to produce this kind of certificates. But if you live in a private settings, then you don't need to have any certificates at all. And taxi service is arranged. It is a private service, and Big Farm is paying for taxi to our patients, which go on for this. And again, we have in big cities food delivery services which work in Moscow, Krasnodar, St. Petersburg, and all other big cities. And it's very hard for patients to come to clinics for chemotherapy, and if there is no paid taxi service, then they go to public transportation. And about the accessibility of modern um, treatment, and the research is going on. The physicians say that everything is uh, as normal, and but we had some issues on treatment. Some funding for a particular medicines were not sufficient, and we complained, and the Ministry of Health responded, and we believe that all these corrections will be introduced, and innovation therapy, which occurred for lung cancer or kidney cancer or metastasis, breast cancer, metastatic, and those for chronic patients, we believe it's tremendous, requires a lot of expenses, millions of rubles, which come from the budget. And not always these drugs are available for all patients, and some of them patients are registered, and some of those drugs are not still registered as the life supporting, in the list of life supporting drugs. Therefore, they are not state approved, and they're not bought by the state and not distributed freely. And the health insurance companies continue to provide free care for cancer patients in most of the cases, and people in the regions, for instance, those whose cancer clinic is hundreds of kilometers away, they can go to a local clinic for chemotherapy and for other type of treatments, and these quotas were actually allocated to the nearby clinics for cancer patients, and commercial clinics which have the all modern equipment, and they definitely have much better performance than these state-funded hospitals. I believe that I briefly covered the situation in Russia, but now I would like to listen to your impressions and who wants to speak now? Irina, may I add something about our Russian situation?
Добрый день, уважаемые коллеги.
Good
Меня зовут
morning,
Илья
good
Тимофеев,
afternoon,
я
dear
директор.
colleagues. I am Ilya Timofeev. I am director of the Cancer Institute Hadassah of Moscow. Hadassah, it's a Jewish word. It's actually from Israeli clinic, and we can use different technologies which are not registered in Russia, not approved in Russia, but are registered in Israel and other countries. One of those technologies was testing the patients for COVID patients, and we have done more than 30,000 tests to our cancer patients, and we were first to launch a survey which included urological cancer like kidney cancer and those who were affected by COVID. We evaluated the outcomes of for these patients, and 9 regions were covered, and we have found that the COVID patients die more frequently than the general population. 18% of those who contracted COVID-19 died. 18%, and besides, the frequency of hospitalization is 48%. So half of the patients had to go to hospitals and be hospitalized. And this in 20% of cases, the patients required the artificial lung support, and we were first to publish the guidelines that, in spite of the lack of certain data, we still need to vaccinate all cancer patients. And it was published in the leading Russian newspaper Kommersant, and all cancer patients who come to us, so they get a jab of the Sputnik 5 vaccine, and we evaluated its efficiency and its tolerance, and as of today, we generalized data of our patients and other patients about the tolerance of Sputnik 5 vaccine, and around 100 patients with metastatic patients got the Sputnik vaccine. Only 28% had some toxicity manifestations of the first and second degree. It's a light degree of reaction, and in most of the cases, it was it's a slight increase of the temperature. And our first conclusion, and we followed those patients for 3 months, and we saw that the tolerance of this vaccine is good, and they should not be afraid of taking the jab. And we can also rely on the efficiency of the vaccine, which say that around 6% of the patients who were inoculated can get infected, and out of 20,000 patients we inoculated, and generally it is quite efficient, and we recommend Sputnik 5, Sputnik V correction, which was studied for cancer patients. We did also a survey for Pfizer vaccine, but we had some limitations from our Nadzor, therefore our uh, regulating authorities. Therefore, we cannot publish any outcomes of the Pfizer vaccine. But what about the cancer? Was is still developing in this COVID-19 patients, and 9 centers were involved in the survey. Those patients who would not get the drugs had the development of the cancer, and in 11%. And we can say that we see the progress of the tumor among those patients in 11% of cases. Is it a lot? Not, it is not that a lot. And we see that in the general population, the, so the risk factors to die from COVID is much higher than to die from cancer. Therefore, isolation and self-distancing and vaccination is our strong guidance. As for telemedicine, we switched to the online counseling, and this telemedicine is a good equivalent for in-person support, and we use new methods for it, and it's another Israeli uh, uh, an, it's a device which is actually attached to a person and monitors the pressure and temperature, and we give this kind of unit to a patient and wears this unit, and it examines the patient online. We collect this data and provide our counseling to the patient. Therefore, telemedicine is quite helpful. And the last, who is in the risk group according to our studies, and we included patients with urological disease. So we excluded the breast cancer and lung cancer. So the highest risk group was the weak patients and patients with have more than 2 organs affected by metastasis, and they're in the risk group, and still they should be inoculated in the primary order. Thank you very much, Ilya. And another question we heard from a regional representative. We see that some people who were previously inoculated and they are getting sick, and yes, we have this information coming that patients, including the cancer patients, those who were previously inoculated, still have a risk of getting infected by, but we knew about it. It's 6% out of our survey, 8% from other vaccines, Pfizer, Moderna, Chinese vaccine. Definitely the risk is there, and we know that 6% of patients may get affected, and new strains can also lead to increased rates of the disease, but it's still not the evidence that we should stop inoculating our patients. 80–90% of patients are not get infected so far, at least. Thank you very much. And I believe that it's a very good to hear this answer from you as a medical expert. Colleagues, who would like to speak? Rekha, we are longing to hear from you. because we had some negative news about an aggressive Indian strain, and people are gravely sick. Ну, позвольте мне.
Yes. Hello. Anna, am I expected to speak?
Да,
Hello?
да, да,
Yes.
все мы вас
Okay.
слышим,
Go
понимаем.
ahead, we hear you.
Now I have got it interpreted into English, so I can. First of all, good day to all of you. And I'm very thankful to Anna and all of you to making me part of this August group to talk about COVID-19 and cancer care in India. You know, so as all of you know, the COVID-19 attacked the globe all of a sudden. You know, and medical fraternity, government, and the public at large was all caught unprepared. This sudden influx of a huge number of COVID patients requires a large number of doctors, healthcare providers, beds, and infrastructure. Not only this, they need to be isolated. All this led to overloading on the health, and this led to the disruption. Just a minute. Yeah. All of this, just a minute. Yeah. All of this led to the disruption in the treatment of cancer patients who are so vulnerable, you know. And 70% of these cancer patients could not access the life-saving surgeries and the treatment. Chemos were postponed. Even the private hospital, the footfall of cancer patients were reduced to 50%. It means even in private hospital, only 50% cancer patients were being paid attention to. As a result, and you can see that as compared to 2019, in 2020, in March and April, only 20% of cases were given treatment and surgeries as compared to the March and April number of the patients. Only 20% cancer patients could go through the surgery in 2020. At least 51,100 life-saving cancer surgeries were cancelled. And in India, and March and May, March to May end in 2020, these and other issues together caused many, many deaths in India. And other health workers like ASHA, which is accredited social health activists, they were all diverted to pay attention to COVID-19. And with the result, there was no one to look after the needs of cancer patients in the community. I'm not talking about hospitals. Hospital, to some extent, they were paying attention, but in the community, the cancer patients were neglected because no NGOs were coming out, no volunteers were coming out in the beginning. Now the scene is changing. Now, research in cancer has also felt a setback, and also in developing countries like India. 95% of the cancer centers are situated in the urban areas, while 70% of our population lives in villages and small towns. And coming all the way from villages and small towns to the metro city for treatment, it was difficult because of the limitations and the restriction on the transportation and lockdown. They could not cross borders of the state. Also, due to low immunity, cancer patients are highly prone to infection, and thus they are highly prone to develop complications and a very severe COVID infection if they get in touch with such patient. And on the other hand, if the cancer patient delays the treatment, if there is a long gap between the two chemos and the radiations, etc., then the cancer may spread, it may become metastasis, which is then it becomes untreatable. So cancer patients were in dilemma. On the other hand, where new patients, suspected patients are concerned, there were those primary health system was shut down in the beginning. Now, of course, it is open, and the community screening campaigns were stopped completely in the beginning. Now there are very few community screening campaigns going on. So with that, hardly new cancer patients were detected, and by the time they are able to detect their cancer, they became metastasis, the cancer spread. Along with that, there were other multiple issues of cancer patients, especially of metastatic breast cancer patients. Emotionally, they felt fear, hopelessness, depression, anxiety. Also, rumors spread by fake news spread by social media added to their anxiety. Transportation during lockdown was very difficult. OPDs were closed for quite a long time. Financially, you know, cancer treatment is the most expensive treatment. And here people are losing their jobs. Some people's salaries are cut by half. So it was very, very difficult to pay for the medical treatment. Also, very few HCP, healthcare providers, the medical fraternity was there to pay attention to cancer patients. Cancer patients are also prone to the decrease of the platelet count, which is very important. And for that, they need blood donors. And during pandemic, it was very difficult to get blood donors here. Socially, they were isolated. But now the things are improving and improving very fast in India, thankfully. You know, gradually medical fraternity and the government are finding alternative methods to attend to cancer patients. Firstly, like all other countries, in India also, we have teleconsultation and telemedicines. The doctor prescribes the medicine online. The patient can get the drug in his or her own city and get and go chemotherapy in a local hospital. Some of the doctors also prescribe oral chemotherapy. Now the patients don't have to come to the hospital for registration because there are long queues of registration, and one doctor pays attention only to 30 patients per day. And if there are 100 patients coming over there, 70 will be turned away and they will have to go back a long distance to reach their home. Now they don't have to come to hospital for registration. They registered it online, and on the day of appointment, they come to the hospital. This stops the harassment which was there in the beginning for these people. Government has also started issuing permission card to the people for whom it is very important and urgent to come out and travel. They can show their cause and get permission card from the government, and government is helping these people very nicely. Also, in all the hospitals and marketplaces and other places, many precautions like PPE, sanitization, etc. are provided. People are being educated on social media how to look after themselves, and many groups are volunteering to come out. So things are becoming rosy, though not very perfect, but quite good as compared to last year. And also now where rehabilitation of cancer patients after COVID-19 is concerned, the total damage done to cancer patients can only be calculated once the pandemic is over. At the moment, we cannot judge it much, and we don't see any sign of its ending very soon. But gradually, things are improving. Even during pandemic, medical fraternity and government will have to work overtime to protect and save of whatever is left of cancer patients after this. And we pray and hope that the things would change very soon. Things are changing, but they are not perfectly changing at the moment. Where vaccination in India is concerned, the guidelines are governed by the government. The data of efficacy and safety of COVID-19 vaccination in cancer patients who are going through the treatment is limited, of course. However, the cancer patients are more prone to infection, and especially to the COVID infection. So it is better to get vaccination. For them, the cancer patients are advised to take COVID vaccination because benefits are more than the risks of the vaccination. Also, cancer patients who have completed their treatment, and now it is more than 6 months that they are out of this treatment, they can all go for vaccination, but they must tell the people if they are allergic to certain medicines, because allergic people cannot be given this jab. Patients who are on direct cancer therapy can receive vaccination only after discussing it with their oncologist. Oncologist will tell the suitable time based on the patient's ongoing therapy of surgery, radiotherapy, chemo, stem cell transplantation, and immunotherapy treatment. The patient should also tell the therapist whether the patient is allergic or not. Now, people ask which medicine is better for cancer patients and cancer survivors. All the vaccinations are equally good for all the people. Patients who are allergic to PEG should not receive COVID vaccination. Now, patients who had previous history of COVID, that means they suffered from COVID, should they get vaccination? Yes, only after getting 100% cure from COVID, when their COVID is negative, then they can go for vaccination. Vaccination should be given to all the cancer patients, irrespective of their antibody status also. Now, the gap between the two doses for cancer patients should be 4 weeks. Though for normal people, the gap is between 4 to 8 weeks, but for cancer patients, it is 4 weeks. As per an article given by Dr. Anil Harur in Indian Express, every patient has a different level of resistance and the disease fighting power. And they should take vaccination. Before going for vaccination, they should confirm and assure that their white blood count and the blood platelets are not low. If the white blood counts are less and platelet counts are less, they should not go for vaccination. First, they should get it right. For the patients who have first had stem cell transplant, or those people who have received CAR cell therapy, who are typically receiving immunodepressive therapy, who are getting induction therapy for leukemia, they should delay their vaccination and ask the doctor, and they should go for, once this treatment is therapies, all the therapies, stem cells transplant, CAR cell therapy, and immunodepressive therapy, induction therapy, when it is completed, after that they should wait for 3 months, and then only they should go for vaccination. The caregiver of the patient should be given priority in giving vaccination, because the patient is with the caregiver most of the time. He or she should not get infected from the caregiver itself. So they should be protected as far as possible. So our government has very wisely broadly given the guidelines for vaccination for cancer patients as well as cancer survivors. And thank you so much for giving me this opportunity. Thank you, Anna.
Спасибо, Rekha. Jacqueline.
Many thanks. Jacqueline, will you share with us about what's going on in your settings?
I will, and hello to everybody. And again, thank you for the opportunity to talk with you today. And it is really good that we can all come together and share. I'll talk a little bit about Ireland first. We're a very small population. We've got 4 million people. So we have done reasonably well. We did have at the beginning where you couldn't move out of our own region, and there was a limit. We could travel 5 kilometers from our home unless we had a letter to say that our work was important, and we had to do that. Things have improved a lot. A lot of our people are now vaccinated, but we still have to wear face coverings when we're out. We were very lucky that chemotherapy did not stop in Ireland. People still got their treatment. Radiotherapy also went ahead. Where our big problem was screening. And I'm sure that was for a lot of countries where screening stopped. So I imagine in the next number of years, we're going to have a huge fallout from that, because we all know early detection of cancer is crucial. Here in my own organization in Ireland, we saw the stress of people's mental health was absolutely huge. So we started off with 1 psychotherapist at the beginning of COVID. We now have 10. So that would be the work that we do most here. It's people's anxiety levels, their depression has skyrocketed. But with the European Cancer Coalition in Europe, we got together with the European Cancer Organization, and we formed a letter that I will read for you now, that we have given to a lot of organizations have signed. We're now talking to the heads of government to try and have something together, that we will actually tackle cancer together. COVID-19 has been here, it's been terrible, but cancer hasn't gone away. And I think in most countries, cancer was forgotten about, and that's very dangerous. As has been said previously, cancer treatment is very expensive. So the sooner we can get the patient treated, the better. So I will read you the letter that we have formulated. And as I said, we are talking to the heads of government to try and put pressure across Europe on this. So the letter says, the COVID-19 pandemic has shaken our world and health system and has had a major impact on people living with other diseases, especially cancer. We recognise this impact goes beyond cancer screening and care. However, we do want to raise some issues that we have observed in our own communities. Prior to the pandemic, death rates in some types of cancer had started to stabilise or even decrease as patients took more active role in primary and secondary prevention and their own care, while cancer services improved and other treatments became available. The COVID-19 pandemic has severely disrupted cancer detection and care services globally. 2020 saw approximately a 40% drop in cancer diagnosis. A recent study published by the BMJ journal demonstrated that delays to treatment have a detrimental effect. We recognise that the healthcare systems are under unprecedented pressure due to the COVID-19 pandemic, and that the global crisis has not ended yet, but that the data shows us that we need to take an action to actively address the issues in cancer care if we are to continue to improve outcomes. We, cancer-focused organisations, are already to support governments in the effort to help cancer patients globally. To improve the situation of cancer patients, governments should, 1, ensure that patients can access diagnosis and treatment safely. Health systems should design COVID-secure pathways so that services for cancer patients can remain open and, where possible, provide alternative treatment modalities, such as home chemotherapy, to help shield patients. Health authorities should communicate the range of actions that have been taken to allay patients' fears about COVID-19 and their condition, including appropriate measures to tackle cancer-related complications, such as cancer-associated thrombosis, cardiovascular disease, mental health, pain, and more. Malnutrition is also mentioned. Screening assessment programs and other means of diagnosis cancer early must also be restored and supported, as well as efforts to raise awareness of these programs. Number 2 is to identify the impact of the pandemic on cancer services and design services to mitigate this. This means collecting and analysing data on the patients who were not diagnosed in 2020, modelling the likely additional demand of services due to missed diagnosis and appointments. In addition, it means investing in the workforce and physical capability to meet this need, given the likely increase in the number of patients diagnosed at a late stage. We already have some analysed data available, and we are willing to provide anyone with all the relevant documentations. And thirdly, we need to resource cancer services properly and safely in the long term. Patients must be at the centre of this action to be taken to rebuild and improve cancer services. This means efforts to increase multidisciplinary care to treat cancer and related systems as described above. Early diagnosis of cancer needs to be accelerated, and the uptake of innovation in cancer care and treatment must happen at a pace and scale to overcome the setbacks to progress what has happened and experienced in 2020. Every effort should be made to ensure that cancer services are not disrupted by any future austerity measures, recognising that spending on cancer has been stable for decades. We are ready to collaborate with all of these organisations to uplift the cancer care in your country and with our resources and expertise. And today we want all governments to make a difference by saying, I am committed and I will invest in prevention, early diagnosis and treatment of cancer. So this is what we're hoping to do within the European Cancer Coalition. Thank you.
Thank you very much. We are also members of this coalition and we are in favor for each line of your letter. And, you know, I have another question. I know that in the Netherlands, the palliative care is very well organized, both at home and in hospitals. And what about under the COVID pandemic? Was there any change in this? What was the impact of COVID-19 on this service?
That was the one end of cancer care that was severely disrupted here in Ireland. So we had people at home being treated with palliative care, and there was a shortage of nurses because nurses were deployed to other services. So quite often we had family being advised on the phone as to how to adjust medication for patients, which is not ideal, which should not happen. Our hospices stayed open and people were treated there, but absolutely there was a huge decline in the care for home management.
Thank you very much for sharing. And I would like to add that in your speech you said about screening and early detection of the malignant tumors and prevention programs. And I have a report from Melita from WHO, and they actually prioritize this issue. And in our opinion, they would emphasize on curbing the disruption of these oncological services, but they say now early diagnostic was their priority, and because many countries completely disorganized or stopped the functioning of this program, and we expect that there will be an outburst of patients once the pandemic is over. And in Russia, we didn't close these programs at all. There were, of course, in disarray, but we still have teams and say a large enterprise has its own medical facility, and inside the collective, the workers, they had the screening, an oncologist and mammographic examination and thyroid examination and skin. What can be done without computerized examinations? And they do this uterus examination for ovary cancer, and they do something for breast cancer. Screening was still there, but we still anticipate an outburst of this spike of rates, because the detection in 2020 or 2019 was half of what was in 2019. in 19, we had 600 patients identified. In 2020, we identified only 300,000, and it is only half of a previous number. And we expect that people will be identified at the advanced stages. And about depression status and anxieties, we had um, we saw that people are very much depressed by the lockdown, and because staying inside the room in the apartment leads to all this upsetting consequences, and the government heard it, and they mobilized psychological support service to resolve this issue. Thank you very much. And now I would like to give the floor to Firuza Abdullaeva from Tajikistan. Firuza, go ahead, please.
Доступа к
As for the access to prevention programs on early detection at some period, we definitely saw a significant reduction and issues because of the lockdown and social isolation, and oncological patients were part of it, and the access to treatment was limited, and the supply of drugs was also faced certain issues and were delayed, and as a rule the treatment chemotherapy is at the expense of patients, and some of the patients are getting humanitarian treatment, and the supplies were limited, and the patients, of course, were very much under pressure. And those companies which previously imported the drugs were limited in bringing these drugs. The planes didn't fly, and we faced a very challenging situation. As for the operation of oncological service, it worked. They introduced those green areas, red areas. They wore PPP, and but oncologists worked very hard. As for palliative care, the patients which need this palliative care, they stay at home, and therefore family doctors and nurses would take the burden of this, but they were overloaded, and the family doctors, and even going from family to family is very hard for them, and of course they limited their services, and the quality dropped because our nurses were overloaded, and physicians at their neighborhoods. And we are also considering the impact of COVID-19 on oncological patients, and the fear of losing jobs, social isolation, and the anxieties, and all kind of psycho-emotional status of people who survived, cancer survivors, was very drastic, and different options are being considered now, and we have a shortage of psychologists in the country. Probably we need to reconsider the programs of training family doctors so that they can provide this primary psychological counseling and support to oncologic patients, and then referring them to psychological centers. It's very hard, of course. very hard to work in these settings to support the cancer patients, and your message to governments is very much inspiring for us, and we believe that we will advocate this in our country, and I believe that this roundtable discussion will give us a better vision of what other countries are doing in India, European countries, and other participants. Your experience and best practices will encourage us for more intensive actions. Thank you.
Знаете, еще такой момент.
And another point, thanks a lot for that. Have you got this online telemedicine technologies in Russia in the COVID settings? We have transfer of the support to online format, and we have this online subscription, and the physician would enter what kind of drugs they prescribe to you, and then a volunteer would bring it your medicines home, and the patients would just stay at home. And online support was also done for those who survived transplantation, and it was a cloud system which allowed a physician to upload the patients and former transplanted patients, and then they would also, the patients would fill out questionnaires, and the system would send automated alarm if some parameters were causing concern, and then the physician would get this kind of red flag and call the patient. And we are ready to share these technologies with you. These platforms have been created with our support, and we would be pleased to share it with you. We also set up into rehab application, and it is a software tool for former COVID patients, and they can do them this kind of physical exercises and cardio, and people online would get connected and jointly, under the supervision of a physician, do physical exercises as recommended, and then the patients would fill out a questionnaire, and physicians would then report that rehabilitation for patients is still going on. Hilola, can you hear us? The floor is yours. Hilora Kaharova, go ahead, please. We cannot hear her. Now I give the floor to Nasiba Nazirova. Can you add something? Nasiba is now providing care to
членам семьи, которые сейчас находятся
her
в
family
состоянии,
member who contracted COVID, and another girl, she's online, but 2 days ago she was inoculated, and she is still kind of feverish, but she is listening to our discussion. She is in the picture. Inga Pasechnik. Can you hear us from Moldova? Terry? Hello, I am online.
to be sure that I say everything correct what I would like to say, I would switch to English because I saw that you have the translation as well. So first of all, let me correct a bit my affiliation. I work in the management board of the North Estonian Medical Center, but that doesn't belong to the University of Tartu. That's a university that I have graduated as a medical doctor, but we are two separate institutions. So what about the COVID situation in Estonia as regards the oncological patients? I have to say that even in this spring, at some point, we were the highest number of new diagnosed COVID patients in the world. Nevertheless, I think that we have dealt with that issue quite okay. Last spring, when it all started, there was more fear and more limitations in everything. But we have never closed down our hospital. We have never closed down an access for our oncological patients. And we have perhaps some limitations as regards surgery, but all patients who have gone through any kind of diagnostic or therapeutic procedures have done first the PCR test, and if the test was negative, then they were admitted for the procedures. We have already for many years in place a number of digital health solutions, such as e-prescription is already, I think, certainly more than 10 years. We have digital registration for patients in place, and also e-consultation, which means that the family doctors can consult with the specialist without sending a patient, but sending a data. And that also has had its positive impact in the patient journey, because it has not been stopped because of the limited access. In principle, the major rules of handling the COVID in Estonia were keeping the distance, the 2 meters, 2 people, washing hands, disinfecting the hands, I would say, and wearing the mask. Public events were also not allowed. And also at some point the restaurants, for example, only were able to deliver at home or sell at the spot, but not eat inside. These kind of limitations indeed existed, but in the moment I would say that there are very few of these limitations in place. And also what we are planning to reintroduce, for example, in our hospital, that we would allow visiting patients if you have been vaccinated, or if you fully vaccinated, I mean, and if you have had COVID-19, but not more than 10 months ago. In that case, you already have to be vaccinated. What we have perhaps reinforced is the telemedicine as regards the consultation for patients. Our health insurance fund has, from the last spring, they have allowed to register for the reimbursement also the televisits. It means that either it's a consultation online, a consultation through chat, using Zoom or Teams or any other format of video conference, or chat. And this also has, not only, I would say that this impact is positive also outside the COVID period, because that is very helpful for those patients who have travel limitations, or who are living in the countryside or a long distance from our medical center. And we have, I think that it's not comparable, of course, with Russia, but for example, we have a lot of islands, and the people in islands, traveling is an issue, in particular with the bad weather. And having this opportunity in place anytime, I think that it supports all kinds of this agreements that we have made, that the universal health coverage, that everybody, wherever you live, independent from your postal index, you will have an access to the high-level healthcare. By the way, it is not this type of teleconsultation, it is not accepted for the first visit, but only for the secondary or third or any repeated visit. What we also started, this project is actually we are preparing the public procurement now, but the objective of this project is to provide a platform for oncological patients who are undergoing chemotherapy to have an online consultation possibility. Initially, that project we called emergency department outside the emergency department, because the idea is to support patients who may have side effects at home, to have a possibility to log into the system which has their medical health record, and also has this piece of artificial intelligence. By introducing your symptoms into the system would help you to give you some guidance on what to do. Either you can do something yourself at home, you can take the medication, you cannot take a medication, you can do this or that, you can call a telephone, you can submit your questions so that the specialist will either during the working hours can reply, or if you submit your question, let's say midnight, then next morning. Or also what the artificial intelligence can suggest you is to call an ambulance and go to the emergency room. So this type of support for patients, that is also the collection of data, because that platform would allow start using the patient-reported outcome measures, which would not only measure the effect of the treatment, but also the quality of life, which is the very, very valuable information for not only choosing the right treatment for these particular patients, that's as part of personalized medicine, but also it would allow to analyze better the effect of different types of treatment on different people. And that would also support the guidelines on different treatment types. What I also can say as regards the vaccination, we started the vaccination in our hospital end of last year. And the government decided that the first line to be vaccinated will be the healthcare providers, the healthcare workers, and also those people working in the ambulance services or in the police, and those basically who are the first line officials or workers. And together with that, the people 80 plus, so that we started with aging people and also people who were on the home care and the special facilities for elderly people. Those were the first line of people to get vaccinated, and the vaccine that we used were either Pfizer, Moderna, or Moderna, Pfizer-BioNTech or Moderna. And later this level of age became lower and lower, and also already at the second line we added the people with chronic diseases, including the cancer patients. So they also had the opportunity. Of course, that's sometimes the problems with people who are allowed to get the vaccination but do not want to, and people who want to get vaccinated but do not still belong to the group. In the moment, we have everybody has an access to vaccination, and we are also planning to start the vaccination of children older than 12 years. So this is more or less what I can say about the activities what we have done. I think that the project that we have started already 2 years ago, and that was addressing the cancer patient journey, that has been nicely engaged also in this all the COVID-19 activities, this type of distance support, the access from with using the different medias, and also the sharing a lot of information. For example, we did 2 films for our cancer patients. One was introducing what does it mean if you have to come to radiotherapy. So basically we took an actor who went through all the procedure in order to know what is that, what you have to expect, how it would look like. And the same with the chemotherapy, because people, if they have not had it before, they might have just the normal fear of what it is that you expect. And then they have heard hundreds of myriad of terrible stories that frighten them. And we have found that the patients have really appreciated that we have made this type of, I would say, explanatory films, because they are certainly not some kind of education material, but it is more like an introduction to this field, and creating this type of atmosphere where you feel supported and you know that you are welcome and that is nothing that you have to be afraid of. So we have, in addition, what I would say, that we have adopted this year the Estonian cancer control strategy, the new one, for 10 years, and expect in the second half of this year also to adopt the implementation plan with the concrete actions from screening to palliative care. And certainly the focus in this, both the cancer control plan as well as its implementation plan, is the patient-centric approach.
Большое спасибо. Терри,
Terry, thanks a lot. I feel that you are the head of the healthcare facility, and your report was very much in depth and stratified, and you told us it in stages. And what I liked is that online services have been introduced. We failed to do it in the federal level, and so far it is not official in our country. It is allowed from physician to physician, and if there are some need of consultation, they can get an assistance from a federal center where more expertise is concentrated, and then the concilium can decide or correct the treatment. But we see that some insurance companies permit buying additional insurance policy which covers this patient to physician online treatment, and the insurance companies are ready to pay it, and it also, we have a lot of gadgets which also allow you to measure the heart rate, oxygen saturation, do the Holter monitoring, measure cholesterol and the blood examinations, and the incorporation of these methods in online follow-up, and of course I can go somewhere and translate to some clinic and then translate this MRT or other, but so far we failed to introduce this physician to patient online consultations, but we will refer to your experience.
Need much the legislation changes, It actually just needed an adding it to the price list. The activity which will be funded by the health insurance. And it was not so much about the legislation, it's just the way of doing things. And what I would also like to add is that we also have the doctor-doctor consultation online, which is called e-consultation, which is available for family doctors with the specialist and specialist. So in all these ways. And also our patients only do not have to can consult online with the doctor, and not as a primary visit, as I said, but the secondary and all the rest. But also they can do the online consultation with the nurse. And you mentioned rehabilitation. That is also something what our rehabilitation department did online, so that it was with the video, because that is important, that it's not only that the patient sees you, but you as a physiotherapist also see a patient, because you see how they move or whether they do the exercise correct. So that it's like both ways. And that puts some limitations, because first of all, sometimes patients don't want to be seen online, and they don't also have a proper camera so that you would really see what they are doing. So that's a kind of technical equipment that it requires. So it has some limitations on its use.
Да, но то ограничения с оборудованием и ограничения в том числе
Limitations on equipment and the internet is which was we are not some locations the internet is not working well, and parents would bring their children to some other locations where we see we have a territory of thousands of square kilometers in some places where there is only one. But we resolve these issues within this. The internet coverage increased significantly, and the equipment was also bought, but not for all cancer patients, because cancer is mostly for aged people, common for those people of senior citizens, and they don't have a good experience in handling these gadgets. And if they don't have young people around them who can help them to get connected, then they are beyond the reach. Therefore, there are some technical limitations. And as for the implementation, we, alas, we cannot introduce this kind of. We have a law 332 which details all kind of treatment, and all our treatment patients is stipulated by this federal law. And in order to include this methodology in insurance, there should be some justification for it, and that should be supported by the guidelines, clinical recommendations, and standards, which says this should be the equipment of the physician, this the patient has equipment, and this is the way the patient should register this manifestation. And it works like that in Russia. And only after that it can be calculated and included in the insurance. So far we are actually struggling with this, and some for parents, for children's insurance, they have this kind of insurance, and they can show to physician online what kind of can happen with the patients, with the child, whether it is a scar or a wound or it is a rash.
To add one more thing. that is very important in this context with these teleconsultations is all the aspects of privacy and with the data protection, because that you have to use the method where the patient can identify themselves and authenticate and access. That is not any session wherever. You have to identify yourself first of all, and that's why in order to log in, for example, to this teleconsultation session, you have to go through our digital registration, to which you only have an access when you have identified yourself with your electronic ID and authenticated yourself with the special codes. Then you have an access to this digital registration in which you log in to your session. And that is something which is very important, that is well monitored, and that allows the trust, because that's important in these things.
У нас в стране существует такой федеральный контур.
In our country, we have this state services platform. It is state, and then the regional services for MOSRU, MOS.ru. It is also a platform where you can come and you have this all your healthcare insurance, healthcare data. I can also check my children at school, and it is my personalized contour. A platform which includes a lot of information of every citizen, and we believe that we can add to this online consultations. But you are very right that this ID should be very closely guarded, and theoretically it can happen that a person just an imposter would like to get this kind of information, but a fingerprint is the latest advance in this, and we believe that we can register patients with this face recognition approach, and the computer can do it with very high degree of accuracy by millions of dots on your face. And this system has been introduced in our customs authorities. But I believe that we have law 152, which is very strictly regulating, controlling this the disclosure of personal information. And if this happens, then it will be a criminal prosecution. Therefore, our policy is quite strict here, but thank you very much for making an emphasis on this. And now I would like to give the floor to Larissa Lopata from Ukraine. Larissa, are you there? Larissa? Hello, the floor is yours. We are very happy to see you. Good afternoon. I'm very happy to see you and to wish you good health and longevity and energy. And I heard about the reports of previous speakers, and they are quite common to what we experience here in Ukraine, because for the last 1.5 years, which we live under COVID, they have changed our life drastically. It is quite different from what we previously knew. And apart from this cancer, we have another enemy, which is coronavirus. And our organization is a volunteer organization, and I'm the head of all Ukrainian and Kievan organization, and I get in touch with the Ukrainian regions So I can tell you that all our regions were then divided for some zones. We had this yellow, yellow and red and orange, and depending on the rate of COVID in the particular region, and then patients, depending on this rating, would get certain care from physicians. And last year in March, when the epidemic started, there was a first wave of the lockdown. And at that time, we saw the patients and physicians faced a lot of problems in coming to the healthcare providers, and these passes were introduced. The public transportation was cancelled. So very hard to get to the clinic and get consulted. It was easier for physicians. They have their cars and they had their permits to travel. But for the patients, had to write letters to relevant authorities, to Ministry of Health, to even the Council of Ministers to get permission for those patients who were on treatment, so that they can get the chance to come to a hospital. And we don't have some statistical data on those patients who died from COVID-19, but 56,000 oncological patients died last year, and how many of them because of died from the COVID-19, it's hard to tell, but by talking to physicians, we know that those who were infected were in a very high risk group. In recent years, in 3-4 years, our healthcare was reforming, and we have completed the first stage of the reform last year, and we were about to embark in the second stage of reform, and we already had some advances in so-called family healthcare, and cancer patients, those who were not able to come to oncological clinics, they could talk to a family doctor and get consultations, and these email references to particular specialists they need, and this reference was valid, and then there were no need to go to by public transportation to a particular clinic, and they could get subscribed, got appointment online or by phone, and avoid queues of people in clinics, and have proper services and consultations. We are a volunteer organization. We faced our own difficulties because we used to talk to patients in person. Every week we would go to oncological clinics, and we consult people. We will counteract the depressions. We bring books to patients. But these days, we have limitations which prevent us from going there, and no visitation is allowed. But physicians would help us to hand over publications to the clinics, and there was this hotline arranged for cancer patients. We introduced online workshops, which was quite a new thing for us, but we were learning. And Irina said that not all of our patients have an access and knowledge in handling the equipment and applications and Zoom, and so we had to ask young people to help our patients to get online. Vaccination started quite recently, and more people are getting the jabs. From February we started this campaign. Oncological patients are in the risk group, but regretfully, the plan of the healthcare ministry is that these cancer patients would get vaccinated in November or December. Although, as I said, the vaccine is now more available, more readily available than before. And when they talk to their family doctors, they can get registered and ask for an early vaccination. But the wish is important. And in mass media is very hard to find any information about oncology. Probably it is good on the one hand, but on the other hand, it is still wrong. But the cancer is not on quarantine. People, there is no lockdown with regard to cancer. And not only cancer patients, but some regular general population has some reservations about vaccination. Some they believe in long-term adverse effects, and but still the cancer patients quite often ask questions about the effect of the jab on the condition. They are afraid of recurrence of the disease. And will the vaccine work if a person gets chemo, and it will be just a waste of time because probably the drugs and the treatment will make the vaccine inactive. And they are quite apprehensive about getting vaccinated in the course of treatment. But now we see that there is more information about it, and life goes on, and people learn to live with the pandemic and get adapted to it. This is probably in the nutshell of what I wanted to say. Larissa, thank you very much. And a lot of our activities now happen online. And we saw a lot of positive developments. And one of the proof of it is our today's discussion, when in 5 minutes you can get in touch with any corner of the world and see what's going on in different countries, and I believe it is quite a positive. And you can plan a a lot of events within a short period of time. You don't have to move anywhere. And for instance, I have another appointment with an oncological clinic in the afternoon, and we also give the floor to our
С удовольствием
physicians,
рассказывали
and
про новые
physicians are
технологии в
very
различных
happy
направлениях.
to use new technologies for various types of care, and they have interaction discussions with their patients and physicians from various clinics, including those from federal healthcare providers, allow people to talk to a huge audience. But still, you can not replace in-person contacts, and you can only start feeling a person when they are very in person talking to you, and then you, when you see with your own eyes what's going on in the clinic, you understand better the situation there. And I would like to thank you very much, and I would like to give the floor to our regional leaders. And dear colleagues, Irina and Nadezhda, maybe you, Tatiana, please, can you switch on your video? My connection is bad, and I believe that Tatiana is our head of the Association of Parents of Cancer Children. Good afternoon, dear colleagues. And I would like to tell you about this maternity issues, and the pandemic had a huge impact on babies in various regions, and some of children were with their parents vacationing, and it took a tremendous effort on our part to help them to return from countries abroad, and we dedicated a lot of efforts to it. And after that, we switched to webinars. We were explaining parents about online consultations. We engaged professors and celebrity physicians who are ready to share and talk about nosologies and treatment they are specialists about. And in some cases, we even had to stop these webinars, these events, because the questions kept coming, and parents continuously were asking physicians to clarify this or that point. And what else? We arranged online consultations of physicians who examined online the children, and that was quite a positive experience we derived from this situation with pandemic. Irina, thank you, Tatiana. Nadezhda, are you ready to speak, to add something to what you heard today? I know that our regional divisions, where the COVID rates were not that high, the patients continued going to clinics, and volunteers were helping them, and they were distributing masks and gloves to patients, and they helped arrange psychologists to talk to patients, which was of great importance. Lawyers worked online, and definitely the scale of this work was tremendous. And you can see that we mobilized even the doctors from the Ministry of Defense, and they deployed mobile hospitals in several regions, and in Moscow we have several of them. And in some other large cities, there were military hospitals, and I was myself sick with COVID. And my mother was in the military-built hospital, and I was actually surprised how quickly they deployed this. And everything was in place, including this air conditioning, and patients were isolated and each in individual room, and the personnel mobilized for it was also there. In Moscow, we had tens of thousands of people sick in a day, and but now the system works um, as a clock, and works very well. And they hospitalized only those people with a low saturation, and more than 25% of lung being affected, and they hospitalized people quickly, and all people are sent for computer tomography, and if your lungs are not that affected, whether you are a cancer patient or not, they return you home if these lungs are intact. And but there are a lot of patients still, and the Lopatkin Institute was specializing in oncological patients who got sick with COVID-19, and all kind of specific treatment was preserved for them, and they did a lot of good work on thrombosis, and definitely it didn't happen overnight, and it was coming in stages, and we saw that physicians were looking for the best way to treat these patients across the world, not only here, but thanks God, this exchange of guidelines was quite vivid, and we have quite different treatment today compared to what the first patients received. Colleagues, do we have anybody who would like to add? I can talk about the city of Murmansk. Can you hear me well? Okay. In our region, the situation was quite different from what you have in Moscow. But we had a specialized hospital built, but they didn't commission it because they said the materials were not suitable, and but they took a palliative care hospital where they dedicated to the COVID-19 patients, and we heard a discussion that palliative care was not provided to patients. Can you hear me well? No, we can hear you well. And when we had the lockdown, we had online consultations, and then the patients from Murmansk were allowed to go for consultations in person to get their follow-up care, and we have a good collaboration with Norway because we're nearby, and we previously would travel to them, and they would provide us a lot of material help. And now we continue these online meetings, and our physicians and Norwegian doctors talk to each other, and we are still looking forward to open borders, and that transportation is uh, still very hard
Ну,
to
понятно,
get,
что возили это все,
and,
там едут люди, везут. Вот, пока вот,
but people would bring certain medicine from Norway.
вот мы ждем, там откроется граница, будем всем
But we are looking forward to open borders soon, and of course, we believe that, of course, online is great, but we still would like to resume our operation in person.
Спасибо
Thank you.
большое, Ирина.
Irina, many thanks. May I add something? Good afternoon, everybody. It's very important meeting. It's good roundtable discussion. It's a St. Petersburg leader of our organization. Yes, we had some disorder initially when the cancer patients were not hospitalized, and the lab were dedicated only to COVID patients, and we had to complain, and then the chief St. Petersburg doctor ordered that the hospitalization should continue for cancer patients, but he didn't mention the lab operation, and then we had to remind the healthcare committee in the city, and we had certain progress, and now with at that time we had even lines of people waiting outside, but we probably the first who provided assistance to patients to in transportation, and we have good friends from transportation companies, and the 8 cars were allocated to us, and we would bring cancer patients, even severe patients, to hospitals, and we helped physicians in St. Petersburg, Kalininski region, and in another center, Raisa Gorbacheva Center, where we helped to bring a girl to hospital as a girl there. And then we opened this hotlines, and for patients who talk to cancer patients, and to help them to get to any clinic in the city. And our city is very large, and but these patients would like to avoid congestion of people, and we bring also this food stuff to patients up to 400 rubles. It is a quite significant amount of food products, and we are organized online dancing, yoga sessions, and some psychologists for free would consult patients and support them, and they continue to do so. I'm so proud that we managed to organize this kind of care to our cancer patients. And now we had first the city was completely open for a while, but now we hear about new orders from the mayor of the city to limit the attendance at theater to 50%. But we, in any situation, we try to find a way out, because we need to go on with our life, and therefore we believe that you can always find a solution if you focus on something. Maybe you cannot organize a large-scale event. We couldn't come to a children's department, but we still organized a kind of festival to children, and there was an orchestra playing outside the hospital, and we don't give up, you see, and we will never give up. Thank you very much. Well, about festivities, I know that you organize it under the windows of those cancer patient units, and it is a very good distraction. And for children, they need this kind of holidays and New Year celebrations. And it's good that you talked about children. We had kind of awareness campaign on PPP, and we saw that people are quite resistant. And but we started to show our children
Год, круглое
from
время, круглые
oncological
сутки.
units which wear masks and gloves around the clock, and they understand they help to save lives. And we said that children can. Why you adults resist? And it worked. And we believe that this campaign was quite successful. Dear colleagues, thank you very much for your contributions, and I have jotted down a lot of good ideas. It was a very nice exchange of experience. I've got a note from the WHO official that they have recorded a lot of points which can be replicated and which highlight the needs of the cancer patients, and to advocate certain issues at the level of governments. I see Svetlana wants to add something. Svetlana, turn on your microphone. She's from the city of Perma. She a regional association. I just wanted to speak about my regional division. We hadn't complaints from oncological patients, but the regular population complained more about the situation in healthcare, and ambulances were late to come, and primary care was kind of neglected. There was some and therefore just regular citizens were complaining that it's very hard to get care once it is needed in urgent situation. But our region is very large and long, and some the regions, smaller communities are very much remote and hard to reach. And questions kept coming, and we had to get in touch with the Ministry of Health, but there were no critical issues still. And later on, the situation improved, and but still, people write certain complaints that there is no early diagnostics, and patients are latecomers, and already with an advanced stages of disease, and quite often people they feel a need to go to a hospital, but They say it's still the pandemic is on the way, therefore maybe I shall wait. And that is a very sad phenomenon. Therefore, still we are getting a lot of complaints from the cancer patients which need help. This is what is going on in the Perm region. Svetlana, thanks a lot. Now I'd like to read the messages which were interesting to be translated for WHO. First of all, that the cancer patients shall not uh, be left behind. You see, it should the cancer care should continue. The donor service, blood transfusion service, shall be donor service shall be resumed. We are talking about the blood and the tissues, and there are all technologies available to protect them from the COVID-19. Online consultations shall get further advances, and these technologies need to be introduced widely to keep people isolated and still stay in touch and followed up. Screening programs shall be resumed with the use of technologies which allow this kind of screening procedures online by using the available technologies. The large enterprises screening shall continue. Psychological support and follow-up shall resume. Again, the funding, additional funding shall be allocated and invested in telemedicine and psychological service. It shouldn't be just charity and coming from the public association. It's great, it's support, but it is not a state-funded system which shall actually make it mandatory. And I liked very much what Larissa Lapata says, that we shall dispel those rumors about inoculations and pandemic, because these myths and rumors exacerbate situation, and we need to have awareness campaign run by the state, by the government. Rehabilitation technologies in the internet, and then provision of technical means, equipment for people on rehabilitation, and close borders. And we were afraid of this interruption of supplies, and it was quite tangible in certain countries, and in some countries, even if you localize production, but it is still import certain components from the another producer country, and this issue needs an attention, and the government shall pay attention to this, and including the measures for disinfection and information projects and programs which we saw in various countries We saw European experience in this field. We saw the Chinese and Japanese programs. They have the videos which were translated kind of social commercials, which talked about the isolation, self distancing, and but we didn't see any kind of video advertisement which is addressed to specific patients, including the cancer patients. Colleagues, thanks a lot for your contribution. Is there anybody eager to speak now? If not, then I would like to heartily thank you all for sharing, for our consultations, our discussion, and I invite you to our Congress on the 26th, 29th of October. It will be a mixed online, offline meeting. If you have got inoculated, we will be very happy to see you in person. We are ready to pay your stay and lodging in Moscow, and you could talk to people from all across the country and our regional leaders of large associations of patients with different nosologies. It will be a tremendous, very beneficial exchange of experience. There will be international experts, the celebrity doctors, professors talking and about different treatments in cancer, latest innovations. It will be a very interesting event where supported by the public chamber of the Russian Federation. Thank you very much. I wish you good health to you and your dear ones, and I am urging you to get vaccinated if the opportunity is there and if the permission is granted from physicians, because our patients need to be vaccinated and some of them stay healthy all life.
Thank you so much.
Uh,
Thank you.